Hello everyone, I'm Dr. Ninad. I'm explaining how a saliva-based COVID-19 diagnosis can be performed. So the basic outline of this presentation will be a problem statement, then proposed idea and requirements. We are planning to build something like this, which you might have seen in your pregnancy test, a color-based test kit that can detect the corona from your saliva. Now, the current diagnosis method basically is oral swab or nasal swab, which has a long waiting time because of its RT-PCR procedures. Then it can cause a discomfort while taking a snap from the nose, and it needs a trained healthcare worker to perform this kind of test. Now, our aim is to simplify this process and use saliva for the uh, uh, detection and then machine learning algorithms if there are any variations to take care of that. So what we will do is we will collect a saliva of the subject which might have antibodies present because of the corona infection, and also uh, we will take a different approach. One of them is electrical parameters of that captured saliva, and then we pass these parameters to a pre-encoded ML algorithm to detect if the patient or the person is having corona positive or corona negative action. So how this works? So there are two ways to go about it. First one is a microfluidic way or a colorimetric way. So if it is a paper microfluidics, then we will have paper strips like your litmus paper or pH strips, where you put a drop of saliva and it changes a color. And then you might have a computerized scanner and algorithm running on it, or you can give it along with a bottle like your pH strip has. So if this is the color, then this is the possible corona case. Similarly, in microfluidic way, we will have a PDMS chip where we put a drop, and then drop of saliva goes inside the chip um, by capillary action, and then whenever it reaches the area coated with antibodies, the light signal get disturbs, and this laser-based detection can be used for the finding if there is any change in the signal will get detected because of this interaction between the antibody coded surface and coronavirus itself. Second one is conductivity based. So basically here what we have is we are hoping that saliva's conductivity as reported in literature changes to a very slight value, which we will amplify using AD5933 amplifier, and then it is given to a microcontroller, and then obviously if the value is within some threshold, we will say it's a COVID positive or COVID negative case. So, what are the different requires from the hospital side is we want to know if there is an electrical conductivity change in the saliva for COVID-19 infected patients from the normal patients. If the hospital has any confirmed colorimetric antibody which changes a color when COVID-19 saliva is mixed and gets reacted. Does hospital had some facilities like electrical impedance spectrometer where saliva's electrical properties can be measured, and then we will do a set of such experiments where a normal saliva and COVID infected saliva will get compared. Uh, can we get saliva of COVID-19 infected and normal patients separately to do the studies? And finally, and do we have a biosafety level 4 where we can do all these studies keeping ourselves safe from the corona? So that's it from this presentation. Thank you.